Hello, and welcome to Forsyth County Schools Suicide Prevention and Intervention Training. The purpose of this training is to assist school personnel in understanding their role in suicide prevention. We will learn the various risk factors and warning signs that may lead a student to consider suicide, as well as the process for referring students to interventions and resources to support their mental health. There are four main objectives within this training. The first is to understand your role in suicide prevention and intervention. The second is to learn the several risk factors that identify a youth at risk. The third is to know the process of referring students. And lastly, to know about the intervention and resources that are available. This training is in compliance with the Jason Flatt Act, which is the Youth Suicide Awareness and Prevention Training requirement for all school staff. This is required in 21 states, including Georgia. Jason passed away in 1997 at the age of 16, and his father, Clark, started this foundation in his memory. Recent data supports the growing mental health needs within our youth. For youth ages 12 to 18, suicide is currently the third leading cause of death. Among young adults ages 15 to 24, the rate of death by suicide in 2019 was about 14 per 100,000. When students complete the annual Georgia School Climate Survey, between 6 to 8% of 6 to 12th graders in Forsyth County indicated they are seriously considering attempting suicide on one or more occasions. From the Georgia Health Survey, the two most likely reasons for Forsyth County students to have seriously considered attempting suicide were family reasons and school grades or performance. While a person who struggles to cope with chronic depression or anxiety may be the image that comes to mind when we think of those who are most at risk for suicide, be mindful that anyone can encounter life situations or stressors that can lead to thoughts of suicide. Most individuals who consider suicide do not want to die, but they see suicide as the only solution to an insurmountable problem. When a person feels as though a situation will never improve and does not have the ability to make it better or the support to work through the challenge, suicide may be considered. You may observe changes in behaviors, including a loss of interest in relationships or activities, the use of drugs and alcohol, changes in eating or sleeping habits, irritability, impulsivity, or aggression. Those individuals who have chronic mental health conditions or are nonconforming in regards to gender or sexual orientation, or who have experienced past trauma, or those who have access to firearms and other lethal means may also be at an increased risk of completing suicide. An obvious but important warning sign that a child or teen may be considering ending their life is talking about suicide. A student may be very direct and say to you, "I just want to die." Many times, suicide is considered as a way to escape pain or a situation, and you could hear a statement such as, "I wish I could just fall asleep and it would all go away." A student may express hopelessness or feeling as though things might not ever get better. A student may feel like a burden to friends or family and say something like, "Things would be better if I weren't around anymore." Sometimes teens may take a passive or reckless approach and increase drug or alcohol abuse to make painful thoughts go away. You may notice that the student seems tired, lose interest in activities or friends, or be withdrawn, irritable, or listless. Now that we have talked about the risk factors and the potential warning signs for students considering suicide, let's now focus our attention on how school personnel can respond appropriately to concerns about suicide. As educators and school personnel, we may collectively spend more hours engaged with a student in a week than a child does with his or her own family. It is important that we look for the warning signs and to look for changes in behavior. It is a misconception that asking someone if they are struggling could put the idea of suicide in their head. Many times, those who are considering suicide are providing invitations to ask if they are okay and are waiting to see if someone cares enough to notice their pain. Well, it can be an uncomfortable conversation talking to a student, but here are some sentence stems that might help. I've noticed you've not really been yourself lately. You've been quiet in class, and I don't see you talking with your friends. I'm worried about you. Are you okay? If you're uncomfortable talking directly to a student, please talk to a school counselor about your concerns. If a student discloses thoughts of suicide, or you become aware of a social media post, or find a writing or a drawing that indicates having thoughts of dying by suicide, immediately contact your school counselor or an administrator. There are school and community resources available to support students who are feeling hopeless. The hopelessness may be related to a situation where the thoughts of suicide may be a chronic struggle that requires ongoing counseling and intervention. A plan will be developed to support the student based on individualized factors and needed supports. Student support staff, as well as a student advocacy specialist, will help the student and the family navigate treatment and ongoing support. If you know of someone in your family or in the community who is struggling with thoughts of suicide, there are resources available. The Georgia Crisis and Access Line can provide mental health clinicians to respond to children and adults to assess their need for immediate intervention and help connect them to a hospital or follow up with a counselor in the community. In addition, the National Suicide Prevention Hotline is available to those who are feeling hopeless and need support. This also relates to the 988 Suicide and Crisis Lifeline. If you or someone in your family needs support, there are also resources available through our Employee Assistance Program and our Mental Health Services Coordinator in the Student Support Department. We are all in this together, and please reach out if you feel that someone is not okay. We thank you for your time and attention during this presentation. Please reach out to your counseling and student support staff if you have any questions.